Good day, everyone. I am Raymond Ceniza from BA Scream 1B, and today we're gonna talk about the drug and alcohol prevention awareness. So, introduction on drugs. What is drug? A drug is a substance that affects the way a body functions. If a drug is classified as illegal, this means that it is forbidden by law. Different illegal drugs have different effects on people, and these effects are influenced by many factors. This makes them unpredictable and dangerous, especially for young people. Drugs affect your body and mind. Drugs are substances that change a person's mental or physical state. They can affect the way your brain works, how you feel and behave, your understanding, and your sense. This makes them unpredictable and dangerous, especially for young people. What is a purpose of drug? The purpose of using drugs is to relieve symptoms, treat infection, reduce the risk of future disease, and destroy selected cells such as in the chemotherapeutic treatment for cancer. So why do people use illegal drugs? People use drugs for many reasons. They want to feel good, stop feeling bad, or perform better in school or at work. Or they are curious because others are doing it and they want to fit in. The last reason is very common among teens. Drugs excite the parts of the brain that makes you feel good. So in this chart, you can see that the highest used drug is the alcohol, followed by cigarettes, marijuana, pain reliever, tranquilizers, cocaine, stimulants, methamphetamine, ecstasy, inhalants, sedatives, heroin, crack, LSD, and the last is PCP. So, the first type of drug is cocaine. Cocaine is a terpene alkaloid and stimulant drug obtained primarily from the leaves of two coca species native in South America, Introxylum coca and Introxylum novagranatis, is commonly used as the recreational drug and euphoriant. The drug sends high level of dopamine, a natural chemical messenger in your body, into the parts of your brain that control pleasure. This build-up causes intense feelings of energy and alertness called high. Next is the heroin. Heroin is a very addictive drug made from morphine, a psychoactive, mind-altering substance taken from the resin of the seed pod in the opium poppy plant. The short-term effects of heroin include a rush of good feelings and clouded thinking. This effect can last a few hours, and during this time, people feel drowsy and their heart rate and breathing slow down. Next is the Adderall. Adderall is a combination of amphetamine and dextroamphetamine, two central nervous system stimulants that improve focus and reduce impulsivity by increasing dopamine and norepinephrine levels in the brain. Adderall's side effects range from common mild issues such as loss of appetite, nausea, insomnia, and more serious rare issues such as seizure, heart attack, and psychiatric disorders. The next one is methamphetamine. Methamphetamine are stimulants, a type of drug that lets people stay awake and do continuous activity with less need for sleep. These drugs are made as pills, powders, or chunky crystals. Ice nicknamed as crystals meth. It is a popular drug, especially with young adults and for those who go to lots of dance clubs and parties. Its side effects includes rapid breathing, an irregular heart rate, and increased blood pressure. Users also complain of sweating, headaches, blurred vision, dry mouth, hot flashes, and dizziness. The next one is magic mushrooms. Psilocybin mushrooms, commonly known as magic mushrooms, and shrooms, are a polyphyletic informal group of fungi that contain psilocybin, which turns into psilocin upon ingestion. Magic mushrooms are known to cause nausea, yawning, feeling relaxed or drowsy, introspective experience, nervousness, paranoid, panic, hallucinations, and psychosis. The next type of drug is the marijuana. Marijuana is a dried leaves of a flower from the cannabis sativa or cannabis indica plant. Stronger forms of drug include high potency strains known as Similia, hashish, and extracts. Many people experience a pleasant euphoria and sense of relaxation. Other common effects, which may vary dramatically among different people, include heightened sensory perception, laughter, and increased appetite. Next is the ecstasy. MDMA, short for 3,4-methylene dioxymethamphetamine, is most commonly known as ecstasy or molly. It is a laboratory-made drug that produces a high similar to the stimulants called amphetamines. It also produces psychedelic effects similar to the hallucinogens mescaline and LSD. The next type of drug is the LSD. LSD was used experimentally in medicine as a psychotomistic agent to induce mental states that were believed to resemble those actual psychotic diseases. Effects typically intensified thoughts, emotion, and sensory perception, and sufficient high dosages LSD manifests primary visual as well as auditory and hallucinations. So next topic is about the alcohol. So alcohol, it is a toxic and psychoactive substance with dependence producing properties. In many of today's societies, alcohol beverages are a routine part of social landscape for many in the population. This is particularly true for those in social environments with high visibility and societal influence, nationally and internationally, where alcohol frequently accompanies socializing. In this context, it is easy to overlook or discount the health and social damage caused or contributed by drinking. Alcohol consumption contributes to 3 million deaths each year globally, as well as to disabilities and poor health of millions of people. Overall, harmful use of alcohol is responsible for the 5.1% of the global burden of disease. So as you can see in this infographic, there are lots of dangers of alcohol, such as cancer, heart disease, accidents, and police arrest. Harmful use of alcohol is accountable for 7.1% and 2.2% of the global burden of disease for males and females respectively. Alcohol is the leading risk factor for premature mortality and disability among those aged 15 to 49 years, accounting for 10% of all deaths in this age group. Disadvantaged and especially vulnerable populations have higher rates of alcohol-related death and hospitalizations. Alcohol abuse is the second most common form of substance in the United States after tobacco addiction. Some people are more severely affected than others. So, alcohol and health. 3.3 million deaths every year is caused by alcohol. Harmful use of alcohol causes 100% of fatal, 100% of alcohol, 22% of suicides, 22% of interpersonal violence, 18% of traffic injuries, 50% of liver cirrhosis, 30% of mouth and throat cancers, 26% of pancreatitis, 12% of tuberculosis, 10% of colorectal cancer, 8% of breast cancer, and 8% of heart disease. Signs of alcohol abuse. Early symptoms of an alcohol abuse disorder includes drinking more than planned, continuing to drink alcohol despite the concerns of others, and frequent attempts to cut down or quit drinking. As alcohol abuse progresses, the individual develops a tolerance to alcohol. He or she must drink more alcohol to get the desired good feeling to get intoxicated. When a person becomes dependent on alcohol and can't get a drink, he or she develops withdrawal symptoms such as headache, nausea and vomiting, anxiety and fatigue. And lastly, as alcohol abuse worsens, people becomes preoccupied with alcohol and lose control. He or she may have blackouts, which are episodes in which person completely forgets what occurred when he or she was drunk through he or she was conscious at the time. Preventing alcohol abuse and addiction. Drink moderately or practice low-risk drinking. The dietary guidelines of Americans recommend non-drinkers abstain from the alcohol completely. But for drinkers and people who want to start drinking, you can limit your alcohol consumption to 1 drink per day and 2 drinks per day in men. Be mindful of your alcohol consumption. Monitor your alcohol intake, whether you are drinking alone or with company of others. Make sure that you drink within the recommended limits. Get support from friends and family. Having people who support you in a great way of reinforce your alcohol prevention strategies. For example, they can help you regulate your drinking, avoid triggers, and create healthy coping mechanisms. So that's all about the alcohol and drug abuse awareness. Thank you.